Hey, do your knees ache every time you walk? Yes. Well, there's no reason to put up with that. You hear me? There's no reason to put up with that. Dr. Michael Glickert with the Vanguard Clinic is here this morning to tell us how we can get rid of that knee pain. And first of all, welcome back, first of all.
Thank you.
Always good to see you.
You too, thank you.
What is Vanguard Clinic? For people that haven't heard of you before.
So we're an integrative medical clinic, and we focus primarily on pain management, specifically with chronic pain. But we do no drugs, so no opioids and no surgery.
So people that are dealing with it at a drug level can find some options that have been very effective for other people.
Yeah, absolutely.
And you surround those people with experts in different fields, correct?
Yeah, absolutely.
That's all part of it. All right, what's available at your clinic for chronic knee pain?
Well, a lot of patients are looking for alternatives to knee replacements. They're very dangerous. A lot of problems can happen with them. So patients are looking for ways to extend those knees as much or as long as they can. So we have some new medications, new therapies available. Synexus therapy, which is unique to the St. Louis area. Synexus. Yeah, it's electric cell signaling therapy. Very little to no risk to the patient. They get to relax and enjoy sitting on a recliner while therapy is done to their knees, and they get up
really
and they feel better.
Leading edge stuff.
Yeah, absolutely. Yeah, it's new to the St. Louis area.
But what about, because we hear a lot about bone-on-bone knee problems. What do you do for that?
Well, there's gel injections that we can do into their knees. Also, the Synexus therapy can help that. And just doing some rehab, strengthening the legs and the knees so that we don't need to, the bones, can push back a little bit.
Yeah. Some doctors get nervous when I ask this question, and I apologize if you're one of them, but what about insurance?
Yeah, we get that question all the time. We accept pretty much all major insurances, including Medicare. Many of our patients can get significant relief with very little to no out-of-pocket because insurance does pay quite well for our therapies and procedures.
And if you're on drugs trying to deal with it now, that may be the number one thing to get you off of those drugs.
Absolutely.
You always have a great deal for the first few callers that we can get. So what is that?
Yeah. Well, we are a very busy medical clinic, and we typically have a wait list. But when we come on the show, we always block off about 10 to 12 spots for patients if they want to come in for a free consultation to sit down with our staff, see the therapy, see the clinic, meet the providers, and that way they can decide if it would be a good option for them.
Well, we've talked about it before. If you're dealing with this chronic knee pain, it's not necessarily forever. You can get relief. The Vanguard Clinic is located at 11605 Stutt. I'm going to call it Stutt.
Sounds good.
That's the German pronunciation. What do you call it?
Stutt.
Stutt? Okay, Stutt Avenue, Suite 120 in Creve Coeur. And you can reach them at 314-665-1770. Write that down. Or on the web at thevanguardclinic.com. Still have questions? Dr. Glickert has agreed to stick around and answer your questions as part of today's Great Day Extra Live. So tune in on Facebook about 10:15 or so when we get out of the program here and get set up over here this morning. Join in on the conversation. That's on our Facebook site, our Facebook page for Great Day St. Louis.
Thank you very much, you too.